Welcome, everyone, and thank you once again for listening to Sports Doc Talk. I'm Will Sanchez along with Dr. Garcia. First off, this show is kind of coming out of the blue. Literally, it was put together in the last hour, and less than that, Dr. Garcia reaches out to me and says, hey, I'm really excited about this injury. And just to let you know, only an orthopedic surgeon would be really excited about talking about someone's injury. So we were like, yes, we have to do it. Let me set it up real quick before we bring in Dr. Garcia. I'm going to admit I have a fantasy football team, and I get this notification this morning saying Deshaun Watson out for the season. Being selfish, first and foremost, I go, oh man, I'm out of a quarterback. What am I going to do? Right? That's the first and foremost. And I know you fantasy football players out there, fans, they know exactly what I'm talking about. But more importantly, it was about this injury, and then Dr. Garcia chimes in. So, Dr. Garcia, when you heard about Deshaun Watson's injury, and the fact that he's out for the year, the star quarterback player for the Cleveland Browns, that they spent a lot of money, draft picks to get. What was your first initial thoughts before we talk about the injury itself?
I mean, obviously going out for the season is a big deal, and his contract is a big deal. I mean, a significantly guaranteed contract after kind of a lot of dilemmas that he went through. You're kind of expecting only the best. But we know how it works in the NFL, especially with high-paid contracts. But you know, that and then getting injured now for the season. I mean, you know, this is not looking like a good for the Cleveland Browns with their trade. So this is pretty frustrating if you were a Browns fan. And then not to mention the uniqueness of this injury.
Yeah, and I can't wait to get your take on this injury, especially how common or maybe not so common of an injury it is. Just to give the audience some context, Deshaun Watson was playing against the Baltimore Ravens, had a fantastic game, and actually came back and won the game and beat the favored Baltimore Ravens in that game. He injured, as we found out now after an MRI on Monday, and them making an announcement on Wednesday that Watson sustained a shoulder fracture during the first half of the game and continued to play. Before we get into the injury, by him continue to play with that injury in the first half, does it have any bearing on how severe it became, or it didn't matter? And before you answer that, why don't you tell the audience what exactly actually the injury that he sustained?
The only clarification I want to ask before I answer this is his throwing shoulder or non-throwing shoulder?
This is his throwing shoulder.
Yeah. First off, I am shocked that he played through the rest of the game with this injury. So to kind of go over it with the audience, and the reason I want to talk about this is something called a glenoid fracture. There's also another name for it, which is a bony Bankart fracture, based off of the description by Dr. Bankart. But when you dislocate your shoulder or have a direct blow to it, you can dislocate the shoulder where the ball comes out of socket. We hear about that all the time in the NFL.
Okay.
And those players come back in a few weeks. You know, usually they get rehabbed or something like that, and they get a labral tear. So usually that'll heal, and maybe that goes on to need something surgical, but not always right away. What he must have done, and again, I don't obviously know the X-rays or any type of other imaging he had done, but he may have partially dislocated his shoulder. He may have had a previous injury that we don't know about. And he broke off a piece of the golf tee. So imagine you've got your socket, which is the golf tee, and then you've got your ball, that's the humerus. And when you break off the golf tee, that's really bad for a number of reasons. One, it makes your shoulder incredibly unstable. And to be honest with you, this is one of the few times I've heard about someone able to keep playing through. So he may not have had as big of a fracture as I was thinking initially.
Yeah.
But the fact that piece of bone broke off with it, that if you miss that and that he goes on to keep playing for another couple weeks, this is a big problem, because the shoulder has such good healing potential that basically what will happen is if you break off a piece of the golf tee and it falls down, you can't get it back up once it heals, because it'll heal and turn into it in the wrong spot. That's called a malunion. So even if he is stable, but the golf tee's gone, then he's at a much higher risk of re-injury.
So he mentioned that, you know, he quote unquote said the whole second half that he was throwing, it was extremely painful to throw the football, and just talked about the severity of the pain. By the way, he completed all 14 of his passes in the second half and led them to a winning field goal to beat Baltimore 33-31. If you, and just in case. So I like you said, I can't imagine having the injury, let alone with my throwing arm. And for any football fans out there, the amount of velocity that you have to put into that ball so it doesn't get intercepted or knocked down or however far that ball travels, I can't imagine. What are your initial thoughts with him playing? I know you mentioned that maybe the fracture wasn't as severe, but still having a fracture in your throwing shoulder to compete at the NFL level, let alone, I don't know if he got hit, took any sacks, ran with the ball, hit the ground, or anything like that. What are your thoughts on just, we talk about these superhumans all the time. What's your thought?
This is a perfect example of superhuman. I don't care if it was even a small fracture. I mean, this is most of the patients that I see with this injury, there's absolutely no way that they're playing any type of football afterwards. I mean, the last two patients I've seen with this have been almost medevaced in to the area. They come in with their arm completely locked at their side. So this is not an injury that you see someone come in and you'll find it randomly.
Yeah.
Again, if it was a very small shell of piece of bone, but usually they don't say this is definitely has to have surgery. So it probably was a pretty decent injury. And what happened is it may have worsened from him playing, right? It could have been a small fracture that hadn't moved, and then he played through it, and then it broke off more as he played through it. And that's very well could have happened with the type of forces that he's putting on his shoulder. So yes, I mean, he's a superhuman, right? He's an incredibly good athlete. And, be it what it may, you could think about him whatever way you want.
Yeah.
But his ability to play through this just shows his level of, athleticism, his pain tolerance. I mean, this is incredible that he's able to go on to win the game with this injury. And then, I love to go into sort of the injury itself. So that my patients and people listening will understand it a little bit better, because it's a little different animal. But again, we talked about the golf key, but the problem is not the injury. The problem is not that he played through it. The problem is that the surgery. So this is one of the hardest things to fix. And the issue with this type of injury is we see labral tears all the time. You can talk about, I'm sure we have a laundry list of players that have torn their labrum and had it fixed. That is a technically not very challenging surgery. It's still a surgery. We take it seriously, but that's not a technically challenging surgery. When you fracture a piece of bone, that's where things go awry. And in a lot of groups, there's usually like one or two people that even know how to fix this thing. And even at that's still tough. I've seen these types of surgeries take 3-4 hours. Now, again, we've got newer techniques, and I'll go over some stuff that we're doing now.
Yeah.
But the older version of this was to do a big open incision, to find it and put screws in it. The problem you have is it's a really small piece of bone. It doesn't work. And sometimes you damage things. And a lot of people still do it that way, and they struggle. And this is one of the hardest shoulder injuries to fix. And so the fact is that he got this is not ideal. And then with newer techniques, we're much faster. And the last few patients I've done of this have done quite well, but it's a bad injury. And the number one thing I'm worried about in him is this. Again, I've had lots of wrong predictions on these players because they're superhuman, but he's going to have the bone fixed and the labrum. Imagine it's all going to have to be rebuilt. And I'm assuming he's going to get a surgeon that can do it arthroscopically, because that's really the way to go. I mean, doing this open, the results are they're not the same. My patients now, I do it all arthroscopically through scopes. It's a lot more technical, but I can do it more efficiently and I get good results and keep that bone up. But I just don't know how he's going to get it done. And I'm assuming he's going to go to someone incredibly good surgeon, because he's obviously getting opinions about this. But the problem is stiffness, and a stiff shoulder in a thrower is a career ender. So I don't know if that's going to be the case. Again, I don't know how bad this was, but this is really concerning, because I worry a lot about a thrower when I have to do a labral repair like this.
Okay, so let's go back to what you said, right? So I'll start with the last thing you said. Stiff shoulder. Now, are we talking about just stiff shoulder after the surgery, or we're talking about something that can stay with that person, athlete, whoever it is, to have a stiff shoulder and not regain the mobility that they had in that shoulder at one point?
That is 100% correct. So the answer is this could be more of a permanent situation. This bone heals very well. I mean, it'll heal in the wrong zip code. I've never seen one of these not heal.
Yeah.
Whether it's healed inappropriately and they come to see me at 2 or 3 months, or whether, if you wait 6 weeks or more on this, the person doesn't get a repair anymore. They have to get another procedure where we actually move a piece of bone to the front of the shoulder. So it tells you how quickly you need to act on this type of injury. And then at that point, if you fix them, there is a chance, because you have to take tissue and fix it back up. You can stiffen the shoulder up. And one of my number one concerns with this injury is the stiff shoulder. A regular labor repair is different, but generally, if you have to do something urgently, surgery urgently, that's never ideal in a situation with any knee or shoulder, right? If we have ACL tears, we usually want to wait. There's a lot of data that shows we should wait between 8 and 11 weeks after an ACL tear, because of the fact the knee's really stiff, unless it's an emergency, like a piece of meniscus is stuck or something else. But those patients are at much higher risk of getting a stiff knee. This is the same way with the shoulder. And on top of that, you have a massive healing response because the bone in the shoulder is so much blood supply that it's a really high risk of instability, or really high risk of your shoulder getting stiff. The good news is, this type of injuries, patients have a much lower chance of redislocating their shoulder or re-injuring it. But the stiffness is much more of a concern with a guy that's, $230 million contract. Yeah. So I'm pretty concerned about that.
So the Cliff Note version is, this is going to heal real fast for the most part because of the location of the blood flow. The biggest concern, besides the stiff shoulder, is where it heals in that placement, right? And if it starts healing in the wrong place, is that something that if it doesn't heal correctly, you have to go back in and then do a different procedure to try to put it back where it belongs?
Yes, but that's usually if you don't fix it. Like the surgeon that he's going to have do it will likely fix it back to the right spot and keep it in there. And now it doesn't always hold perfectly, because these are really tough. I mean, imagine you have the side of a deck. I'll try my best. And you have a little tiny post on that deck, but it's really loose. And you can only fix it with you can't fix it with a screw. You can't fix it with a big mount. You can only fix it with a few toothpicks. And that's essentially what you're doing here. You've got to fix it the most delicate way possible so you don't break the piece of bone, because it's so thin. But you want to get it to hold up in the pedestal. So we have new technology using Arthrex technology and other technology that we actually use, that we now can fix it without using any screws or anything like that. So I can do this all minimally invasive. Like, if you got a picture of one of these patients, you would never know they did surgery on them, because everything is hidden. It's all these really minimally invasive, really low profile, brand new sort of anchor constructs. But it's still, the concern is the stiffness that we talked about.
So what is something that a surgeon would have to look for when you're putting, let's say, these suture anchors in, if most likely doing arthroscopic? Is it the amount of tightness, or putting in the right place, or am I just kind of overthinking this at this point?
You are not overthinking, but the hardest part is just getting this piece fixed back. Gotcha. Because this is it moves around. It's very challenging. This is one of those ones, if the listeners want to check out the website, I just posted a brand new video on actually how to fix this, which is why I was so interested in talking about this. Yeah. Because I was just talking about this topic and showing some people the new technique we use. But you want to see how you fix one of these arthroscopic glenoid fractures. When we do this post, I will post about my website link so you can take a look at it. But it's just a really interesting injury pattern, because it's really uncommon. I see a very high volume of shoulder instability. Maybe I see over 100 to 150 patients that have unstable shoulders a year, and probably have to operate on 75 of them a year, 80 of them. I see probably 2 or 3 of these a year, and I have to get referrals from them from all around the area. So if you imagine how uncommon this is in comparison to regular injuries, it's pretty low. Some surgeons a lot of my patients come for second opinions for these. Yeah. And when they see another surgeon, some of these surgeons say, I haven't seen one of these in 3 or 4 years. So if it just shows you how uncommon, how difficult, it's kind of a nasty combo. Now, again, if you know what you're doing, you can get good results. So I don't think that Deshaun Watson's going to have a poor result. I hope he doesn't. Yeah. But nonetheless, it's something that people should be aware of, because this is not just a standard injury.
What's normally the injury or the action that the patient is involved in when you normally see these type of injuries in the shoulders? Is something that's like, if you do this, this is a common injury for that, whether it's a sport or falling on your shoulder, skiing, or what? Is there anything that's common, or it's just kind of random because it is a random injury as it is?
Well, this injury usually comes with a shoulder dislocation. So the person arms outstretched all the way back, like a cocking motion, like a throwing motion.
Yeah.
And that's when it can come out. The last two, though, randomly I had, one guy was in the middle of a park, got his arm caught on a bush 10 miles out, and had to limp home and drive for 4 hours into my office.
Oh, my
so
Lord.
That just gives you an example of it just comes randomly. I had one person that fell on their bike. One person got hit by an Amazon delivery truck. So, the injury patterns are different all over.
I'm sorry for laughing.
They're doing fine. They're all doing fine.
All right.
So. But nonetheless, for the listeners, really just to understand the injury and the differences in it. And again, maybe we'll look back in a year and Deshaun Watson will go on to win the MVP next year, and I'll be wrong again. But even though it heals fast, we're still looking at a solid 5-6 month recovery for him. So this is not something that is going to be quick fix and he's going to be back. I mean, hopefully next season, but we'll see. The throwing shoulder is not ideal.
If everything goes right, is there still any concern, right? I'm thinking about a quarterback here and throwing a football, of range of motion. Is there any concern, or because it's in the throwing shoulder, automatically it becomes a concern no matter what the results of the surgery is?
I would be very concerned if I were the Cleveland Browns because of the range of motion. I mean, that's the only thing I'm concerned about. Like we had mentioned before, when you fix labrums, labral tears, just the one he has a labral tear and a piece of bone that broke off. They come together, kind of stuck together. So just the labrum repair alone, even throwers do well, but those are still concerning. This is a piece of bone and it's at a much higher risk because it's got to get fixed so quickly. It's not like he tried to play through the season. It's not like he got his motion back. I mean, we're talking about this. He's probably getting surgery in the next week. And if he's not, I'm surprised. But once they made the announcement, I bet he's getting surgery in the next week. I mean, you want to fix these within the first 2 to 3 weeks.
Yeah.
If you can.
I think about football players, and I think about football pads, working out, throwing a ball, getting hit by 300-pound men, multiple 300-pound men. Is there concern with continuous pain with an injury like this, or if everything heals right, it's just going to be the normal pain of getting hit by a 300-pound man?
Yeah, so there's not a lot of good long-term data on an injury like this because they're so uncommon.
Yeah.
But what we could tell you is that anytime you break that joint surface, your knee, like a fracture of the knee or a fracture of the elbow or a fracture of the wrist, no matter how good the surgeon is, they don't always put it back exactly right. And hopefully they do. And even if you get it perfect, there's still damage to the cartilage. And the cartilage doesn't like to be damaged. It doesn't like to be separated, beaten up, pulled back. Yeah. It just doesn't like it. So his risk of arthritis in that shoulder is significantly higher as a result of this injury. He won't feel that pain for a long time, and he may not ever feel it. But nonetheless, that is what his risk is. Short-term pain with this, it tends to be very minimal. My patients are happy with the result, but my patients aren't Deshaun Watson.
Yeah.
With this injury, I mean, can't think of the last athlete I've had with an injury. I've had football players with this small bony Bankart, but if he took off a bigger piece of bone, that is concerning. But again, I wasn't there. I don't have the X-rays. I don't have the CT scan.
Yeah.
But I think it's good for the listeners to hear the different levels of this injury and what this means. But you can imagine, this went from like, oh, we don't know, this is okay, you played through the thing. Now he gets surgery, it's done. There's not even a question.
Man, obviously we know he's going to rehab the hell out of it because they're just programmed to just kind of work all the time. That's usually that, we've had these discussions on many shows that's the main component after you've, rebuilt and fixed the patient. And we had the discussion with our physical therapist that the next step is the rehab. Just to kind of give some context, if it was just kind of like a regular, John Doe walking into your office and they had this type of surgery, what is a similar kind of rehab or exercises that you're now looking to do to fix the shoulder, stabilize the shoulder, strengthen the shoulder, and trying to get back to some normality?
Yeah, so the problem with this injury is if you have a regular labral tear, you can move someone pretty quickly.
Yeah.
Sling for a week or two, come out of it really quickly, get motion back. And we're getting more and more aggressive the better technology we have.
Mm-hmm.
They've got to fix a piece of bone, and the bone takes about 6 weeks to heal. So if you imagine, he doesn't want to overstress his shoulder so quickly.
Yeah.
But you want him to get the motion back. But if he gets the motion back too quickly, he can pull that piece of bone and break the entire fix.
So
or push the thing down.
Yeah.
It's a catch-22. And so, he may get repeated x-rays. He may get CT scans and check and make sure he's not moving it. I don't know what level of overkill they're going to do to check him. Or they may say, hey, listen, we'll get it good enough. Even if it moves a little bit, you're going to be stable and you're not going to have pain. So I'd rather you not get too tight and you can throw again. So I don't know what they're thinking per se. If I was taking care of him, I'd probably give him a little bit more accelerated protocol than my regular patients. He's still a young man.
Yeah.
So he's going to heal really fast. I mean, I would tell you half these injuries are usually in patients over 30 years old.
Yeah.
And so they tend not to heal as fast. They still heal well, but they're not as fast. He's younger. Yeah. And he's a super athlete. And so probably better to get him going sooner and to risk, because this place pulling off and not healing and having further issues is a pretty low risk. Him getting stiff is a pretty high risk. So if you're thinking about how we determine what someone should do for their rehab, we try to, well, that's the way it works in life. Not all my surgeries they're custom approaches. You can't just, every person's different. And so he's going to hopefully get a custom approach, so he's going to start strengthening at 6 weeks. Our goal is hopefully that 5 to 6 month mark, but he may start throwing sooner. Who knows? I mean, there's no way to do an internal brace in him, but who knows if they'll try it. For just to make you happy, Will. But nonetheless, we've already seen freak recoveries with Aaron Rodgers throwing on the field. So maybe he'll prove me wrong.
Everyone should get an internal brace. I'm just saying, it's everyone. You get an internal brace, and you get an internal brace. It's like Oprah, like just giving out internal braces everywhere. Looking ahead, right? And obviously, there's no way for you to determine because obviously you're not going to be with Deshaun Watson with their team. You haven't seen, whether it's the MRI results and going forward, because pretty much you're telling me they're going to get in there, they're going to fix it, try to do a great job, and then monitor and then try to maybe fast track it without injuring it so we could be aware of stiffness, try to get some mobility, and then work your way up. So it seems like there's all these different levels, and the only way to do that is to monitor the situation constantly, which obviously they're going to have the best doctors, and try to protect their monstrous investment of a player going forward. But training camp, it's in 7 months. I know this is crazy. I know we're in football season right now. We're kind of holidays are coming along and everything else. You're throwing the ball, June is one of the things. We saw Daniel Jones get injured and how long he's going to be out. 7 months from now, throwing an NFL ball, is it really no way to determine what the result's going to be? Or I guess maybe the better question is, what would be a concern for you if in, let's say, 4 months from now, Deshaun Watson is not doing what? And then that might determine whether they're going to be ready for the next season or not.
I just think if he's not throwing the ball yet, I mean, the thing is he's going to probably have to wait. I mean, a thrower is different than any other athlete we deal with. Yeah. This is the hardest of all the things we do when it comes to a shoulder injury. For me, my hardest thing in my office is dealing with a pitcher or a quarterback that injures their shoulder with a labral injury. So this is the hardest thing in terms of surgical outcome, because you just don't know what they're going to do. And we've seen better and better results, and our results are getting better, our data is getting better, but you just don't know. And so I'd like to see him start throwing at 4 months, and hopefully that 7 month mark, he's rocking it and whipping it and accuracy's there and everything else. Yeah. But if you're 5 months out and you're not seeing him trying and throwing, you should be really concerned, because they're clearly trying to figure something out. Now, again, I don't know. We'll see how it goes. And maybe he'll be on the field throwing balls at 2 months, and everyone will say Dr. Garcia has no idea what he's talking about, but we'll see.
Hey, we say that already jokingly. Listen, everybody, get an internal brace. Ask Santa for it. Put in your stocking stuffer. Whoever you're asking for, everybody get an internal brace in their stocking stuffers. It's just going to make life a lot easier. Anything else as we wrap it up, Dr. Garcia?
No, I just wanted to make sure the listeners learned about this injury. It's very interesting. And really, when you see that, you're saying, oh, what the heck happened? He broke his shoulder. But the good news is it's not as bad as a lot of other injuries we see, people that fall off ladders, et cetera.
Yeah.
But it's a unique injury to an athlete such as this, and people should know what the outcome is and the surgery. And this is not going to be a chip shot. So if they get him back next year on the field, kudos to those surgeons.
Remind everyone to check us out at sportsdoctalk.com. We've got some great content there, and we always remind our listeners there's transcripts of our shows, so if you don't want to listen to us, then please read up on us. We've got some great information. Remember, we're talking all sports, all orthopedics all the time. I'm Will Sanchez, and Dr. Grant Garcia that gets extremely excited sending me text messages when people get hurt. Only Dr. Garcia can love you a certain way. So Dr. Garcia, thank you so much for your time, and everybody out there, thank you for listening.
Thank you, guys.